Hello everyone. In this video, we are going to learn the therapeutic skill to perform mobilization with movement technique to treat the temporomandibular joint disorders. The therapeutic technique that will be demonstrated in this video can be utilized by physiotherapists to treat pain and stiffness in the temporomandibular joint, especially during the mandibular depression or mouth opening movements. That is, due to internal derangement of the temporomandibular joint, whenever there is restriction in the mandibular depression movement, the mobilization with movement technique can be utilized. Now, before we start with the practical demonstration of the mobilization with movement technique, a physiotherapy student must know that these temporomandibular joints are pair of synovial joints which are present on each side. And these are formed by the articulation of the condylar head of the mandible and the mandibular fossa of the temporal bone. The joint has a articular disc which separates this temporomandibular joint into two compartments, that is a lower compartment and a upper compartment. Now, during the mandibular movements of depression, elevation and side-to-side movements, there is sliding and rotatory movements that are taking place. And what is important to be noted is that the upper joint compartment is responsible for producing the translatory or the gliding motions, whereas the lower compartment of the temporomandibular joint is responsible for producing the rotatory movements. So in this particular video, as we will be discussing and demonstrating the strategy to treat the reduced mouth or jaw opening. Now, it is also important to understand at the same time that during the mandibular depression movement, the condylar process of the mandible as well as the articular disc moves anteriorly. And this depression movement of the jaw is limited by the articular tubercle which is present anterior to the temporomandibular joint. By internal derangement, we mean that the articular disc can slip from its position and can lie anterior to this articular tubercle. And when this happens, there is limitation in the mouth opening movements. So now let's move on with the practical demonstration of the mobilization with movement technique to treat reduced jaw or mandibular depression movement. So today I have with me Shashwat Pandya, who is a MPT neurology student, who is going to help me with the practical demonstration of the mobilization with movement technique to treat TMJ dysfunction that is resulting in reduced mouth opening. So for the practical demonstration, we are going to treat the left side TMJ dysfunction. For this, the therapist is going to stand on the right side, that is contralateral to the side that needs to be treated. The therapist's left arm and forearm is going to wrap around the patient's occiput and the temporal bone, and the hand is going to rest over the forehead. Now, this is going to help us in the stabilization of the upper component of the TMJ joint. Now, the patient is going to be next asked to open the jaw to the available range, and the therapist is going to insert the gloved thumb intraorally so that the thumb lies superior to the posterior part of the lower teeth. And now the index finger is going to wrap around the angle of the mandible. So this is going to be the hold of the therapist, while the other fingers are going to be curled and they will be resting under the floor of the mandible. Now with this hold, the therapist has full control over the temporomandibular joint movement in terms of the side to side gliding or the translatory movements and the traction or the inferior glide movement. Now a mirror is going to be placed in front of the patient, and the therapist is first going to observe the quality of the mandibular depression or mouth opening movement. Now what is important to be looked into is that when the patient opens the jaw, does the chin deviates to one side, and if this is happening, then this needs to be corrected first during the delivery of the mobilization with movement technique. So let's say the chin is deviating towards the right during the jaw opening movement. So what the therapist is going to do is, after placing the hand in the desired position, to correct the deviation of the chin from left to right, the therapist is going to give a medial glide to the temporomandibular joint. And now while maintaining this medial glide, a inferior traction or a inferior glide is going to be applied to the temporomandibular joint, and the patient is going to be asked to move the jaw in the direction of mouth opening. Now, prior to the mobilization, the patient will also be instructed to keep 3 fingers over the chin and use them to provide overpressure at the end of the range of motion only if the opening is pain-free. Care should be taken that the therapist has to instruct the patient that not to apply the retraction movement to the jaw during the mouth opening movement. So it has to be a purely depression movement of the jaw and not the retraction movement. Also, the patient can use these fingers to keep the chin in midline during the mouth opening movement. So the technique is going to look something like this. The patient is going to place 3 fingers over the chin and is going to open the mouth in the available range. The therapist, after stabilizing the forehead, is going to insert the gloved thumb and it is going to be placed over the superior part of the lower teeth. After positioning the hand that is required to deliver the glide, the therapist is first going to correct the deviation of the chin by giving either a medial glide or a lateral glide, whatever is desired. After maintaining that glide, the traction or inferior glide to the temporomandibular joint is going to be added and the patient is going to be asked to open the jaw. The mouth has to be opened only up to the range where it is pain-free. At the end of range, the therapist can ask the patient to apply overpressure, which has to be maintained for around 2 to 3 seconds, and then the patient has to return back to the starting position. And this technique has to be repeated for around 3 to 4 times, and then the joint has to be reassessed. So this was all about the practical demonstration of the mobilization with movement technique to treat reduced mouth opening in patients with temporomandibular joint dysfunction. Also, please note that strategies or treatment techniques that aim at relaxing the muscles of mastication like the masseter and the temporalis can also be utilized along with this technique to improve the outcome of the treatment. In our next video, we will be demonstrating the self-mobilization technique for the temporomandibular joint, that is also known as the scream and stretch mobilization technique. And this can be prescribed to the patients who have temporomandibular joint dysfunction, who have been treated through mobilization with movement technique. And in order to maintain those gains, the patient can perform this scream and stretch mobilization at home. So see you all in our next video. Till then, keep learning, keep sharing, and stay connected.